Rea was diagnosed with prostate cancer in 2009. This is Rea Wikaira, sorry, I should introduce him properly. And he's recently stepped forward as a supporter of the prostate cancer screening and improving outcomes for men with advanced prostate cancer and reducing the disparities in outcomes that exist between Maori and non-Maori men. Since undergoing chemotherapy and treatment with new advanced therapies, Rea has spoken out regularly in the media and in political meetings about his experience with prostate cancer. He advocates for men to be proactive about managing their health and their disease. He speaks openly about the challenges prostate cancer creates for patients, their families and whānau, and the cultural impact it has on our communities, affecting middle-aged to senior men. He's an advocate for prostate cancer education, enhanced patient support and treatment equity. He's now conducted numerous media interviews, provided a voice for men living with prostate cancer over the last couple of years. Rea is of Maori descent and therefore is also well informed and understands the inequities that exist between Maori and non-Maori, as Professor Lawrenson was speaking about earlier. He's highly skilled at articulating this to all levels. Rea's former chair of ALAC. He's a business consultant, advisor and project manager. He's also a member of the Tiwananga Aotearoa board, and he's a former national operations business manager of the National Maori PHO Coalition, and executive trustee of the Central Region Emergency Services Trust. Prior to this, he was chief executive of Auckland Westpac Rescue Helicopter Trust, and he's previously served on a number of government boards in various roles, including Director of Health for Waikato, Vice Chair of the New Zealand Lottery Grants General Grants Board, and Chair of the Year of Maori Language Grants Board. He's also been a serving Justice of the Peace for 20 years. Rea, thank you very much for coming and sharing with us.
Well, good afternoon, everybody. I'd first of all like to acknowledge and thank the Prostate Cancer Foundation for the opportunity to be able to speak, but also in what they are doing to promote and move the education and understanding of prostate cancer throughout the country. Also, Janssen Sealag, who are a pharmaceutical company that has been heavily involved in prostate cancer medications and so on, and particularly, as we'll talk about today, the promotion of Zytiga or Abiraterone, which is one of the medications that you've just seen as an option for advanced prostate cancer. I'd also like to acknowledge Google for giving myself the opportunity to be able to learn more about this disease and what have you. And I also like to thank or acknowledge Zoladex and also Prednisone for one, of course, reducing my testosterone to virtually nil, which has now made me the most safest male driver on the road, and for Prednisone to be able to reduce my expenses and not having cosmetic injections to keep the wrinkles away. In about April 2009, I was diagnosed after a recreation accident brought this to light to have a PSA test. Now, at the age of 59, I'd actually missed 3 years of my annual checks. So my last PSA test was 3 years prior, which was within the normal range. When the broad spectrum test came back, my PSA was 17. And the GP recommended that I have another PSA test within a month, at a month's time, and that was then 21. And so after an examination and referral, I subsequently had a biopsy with the urologist, and that was then when they and of course naturally MRIs, bone scans, CT scans, and I was diagnosed with metastatic prostate cancer. Now, to someone who has had a pretty active life, both in a recreational sense and also in a working sense, and also, working in the health system for some time, I actually knew in general terms what prostate cancer was and what it meant. I didn't take cognizance of the fact that when it's you, it's a little bit different. And so the reality of having metastatic prostate cancer diagnosed, quite a few things were put on the table. One is about the survival rate. Well, there was none. And most probably I had about somewhere in the region of 5 really good years left, if you like, give or take. And that, interestingly enough, is reinforced by some of the things you may not often take much notice of. Like a couple of days later, I went to see my insurance agent about my life insurance, because as you know, in life insurances, if you have a terminal disease diagnosis, they will release it early. And the moment that I told them what I had, and I told them the Gleason scale, which was 9 and 10, the piece of paper that the insurance agent had been holding up here was signed and handed back to me before it hit the desk. And I have to tell you that the cheque was in the mail within a week. So this keeps reinforcing about the so-called end game factor of how far away this disease is actually going to take its toll on you. And so I spent several days, if you like, lying in bed, feeling sorry for myself, thinking, and like most probably some of you that are here, you're going, why? Why me? You go through the anger and so on, and I was still lying there until my wife called out, "It's your turn to take Tane to school." Tane is our grandson. We're bringing him up. He's lived with us since he was 6 weeks old. He is now 12, going on 19. And he was just on 9 at the time. And I went, oh, jeepers, I was lying there unshaven and all this thing, and got onto my jeans. So we're driving off to school, and we're going past the cemetery on the way to school. And of course, he's very, we've not kept any secrets or anything from him. And he said to me, "Poppy," he said, "when you die, are you going to be buried in that cemetery there?" And I said, "Yes, most probably." He said, "Oh, that's good." He said, "I can come and say good morning to you every day I go to school." And on one side, was in the innocence of a child. And then on the other side, I hit the brakes, in which the ABS on a 2004 Prado is still pretty good, and the car stopped in the middle of the road. And I turned to him and I said, "Hey." He said, "What?" I said, "I'm not dead yet." He said, "Oh, no, I didn't." I said, no, I know you did it. But that was very, very nice thing for you to say. He's never forgotten that, and neither have I. And so started the journey of treatments. And after the diagnosis, I was the opportunity of having surgery wasn't there, if you like, and I was referred to a radio-oncologist, who went through the whole process of telling me that we actually need to get to work on you now. And, you can go away and discuss more and think more and ask more questions, but my advice is we get going now. So, okay, right, so let's get going now. He said, "Right, get up on the plinth." So I hopped up there, and for those of you who know, he said, "Lift your shirt." And this was when the first Zoladex injection was coming, which comes every 3 months. And as you all would know, when you're with a GP or a nurse, whatever, who's going to give you an injection, there are some obvious things. You see them draw it up? Okay? You always do. No one tries to hide anything. Get the air out, and then they come over and swab, and then you get your injection. I didn't see anything with this one, because he went out to my right, out of sight, out of peripheral sight, but I could hear some metal snapping and clicking, which sounded like an Uzi with a magazine being put in and it being cocked. And then he came around, still with his hand behind him, and I still couldn't see anything. And up, I had about a millisecond to see this thing come up and go in there, and bang. And I had never felt so much pain. I'm not scared of needles, doesn't bother me, but I did note that was somewhat of a large needle as it went down in there. And so began the Zoladex. And then not long after, I was prescribed radiation therapy around the lymph node prostate area, and continued on the ADT treatment for some time until I was referred then to medical oncology, which was approximately a year or so later. And in the interim, you're still doing CT scans and blood tests on a regular basis, so that they're monitoring. And it was there that my first assessment of medical oncology was with Dr. Peter Fong. And if I can just pause here at this point in time, and for those of you who understand, who are actually in the system, if you like, that I have to say that the oncology services, if you like, in this area with Auckland District Health Board are second to none. And these people are highly committed, very committed people, and that's from your reception people at the desk, through your nurses, through your other support people, your oncologists, your registrars. Everything is just fantastic. And in my experience has been that everything that you've had to do with the specialists and or the whole system has been seamless. I haven't had a referral go over 2 weeks. I haven't had anything that you would even term to be delayed or the system dropping off. And so around about the referral with Peter Fong was the preparation to look at docetaxel as a chemotherapy, as a remedy to move along. That was delayed because I had an acute, the nodes up here expanded. I woke up one morning, I was looking in the mirror, just getting ready to go to work, and here was a baseball size growth just come up on the side of my neck. And that caused a slight panic around the house, and so fortunately for me, I actually had an appointment with the radio oncologist that morning, and so some urgent or acute radiation therapy was prescribed for that to get the growth down before I could start chemotherapy. The side effect to that was that I was with the overburn from the radiation therapy, which went on for a week. My esophagus got highly inflamed with the overburn, and it actually closed up and I couldn't breathe. And being the ex-CEO of Westpac Rescue Helicopter, I was able to avail myself from Waiheke Island, the services of that, to get me to ED. And from the time of the 111 call to the time I was in ED, looking at the first person specialist to start looking at what I was to do was 21 minutes. And so I was pleased to know that all the outcomes and KPIs had been fulfilled from the organisation that I was responsible for. And then shortly after, I started on the docetaxel. Now, all of that time, all the way through, from 2009 right through to the chemotherapy and beyond, I continued working. And why? Because I had to, because I got a little fella to bring up, and there's two other little ones who sit on the periphery that I'm also responsible for, which is my granddaughters. And but also my wife has breast cancer, so she had a mastectomy 6 weeks ago, and she's just finished her radiotherapy. So we affectionately call oncology our point of contact. So what we've done is been able to manage to get our consultation days on the same day and so on. And those are important things, because the purpose of why you do these things, why I fully understand, and I also know that I'm at a stage at that time, particularly when the chemotherapy was going on, that it's not as bad as everyone had thought, and not as bad as I had thought, because I'd seen people with chemotherapy before in the so-called old days, and it was hell to them. You could see it, and a lot of them gave up halfway through or partway through. The chemotherapy with docetaxel is not as bad as it sounds. Yes, you do have side effects. Yes, you do get tired and those things, but the reality was I carried on a pretty busy job. I was an operations manager for an organisation that had over 70 GP practices throughout the country, which meant I had to travel all the time. I just continued. You manage yourself around that purpose. The other thing I also decided to do was to keep exercising, and that's one of the things I discovered that I became an expert at, is that I could operate within, and I have to operate within 100 metres of a toilet, and become very much of an expert on the quality of toilets and how fast you can get the doors open, through to do they have adequate resources in them as well. And that's actually important, because what actually happened after, which is one of the side effects from that I picked up, if you like, from post-dose Taxol, where the tumours had reduced in size, and but I was able to actually go to the bathroom and actually like I used to, with no side effects. The only thing was, the only catch to that the warning time was much less. And so those were some of the side effects. And in February this year, I started on Zytiga, or Avitrone. And for the first couple of prescriptions, that is $5,000 a month. I had to pay for it myself. And I need to tell you, I'm not a millionaire. I have to still keep working to pay for that, those types of things, but I can't afford not to. And the interesting thing is, in that first month, there was somewhat of I would term a almost miraculous turn on the quality of life. And I was constantly checking myself and saying, now, am I really better? Do I really feel better? Because I had the phrase, I haven't felt so good for over 20 years. Or is it that because I paid $5,000 and I want to get it my money's worth? You know? But the reality was that it was working, and when I had my CT scans a couple of months ago, the tumours had reduced even more. Now, understanding that it's not a cure, it is enhancement and quality of life, if you like, and it has been. So what are some of the things that you have to do to look after yourself? One is that you have to constantly question, and you have to constantly educate yourself, and that's why I acknowledge Google right at the beginning, because you actually need to understand. And I'm understanding it even more, like listening to Peter and Ross and the urologists today. I mean, there's more and more you learn about where this disease at. And I guess strategically, the view that I have with all of these things that are going on, particularly what Peter just talked about now and what can happen into the future, is that there is a potential for this disease to become a chronic managed disease from a terminal disease. And that's no different to something like diabetes or heart disease, where you can actually manage within certain criteria. And that's certainly what I'm looking forward to, and I'm working towards myself, because I've seen the results in it. I have to also acknowledge my wife with all her strengths, because you see, like most of the men here and most men elsewhere, the women in the lives of men are often the facilitators for these things to be found out and happened. And I've seen it even myself, and I know, I've been to GP practices, whatever, where I've seen wives virtually frog march their husbands into the door and somersault them in front of the GP and say, now you do this, versus, a more facilitated coercion of getting them in. But the reality is there's two things, and when we talk about the inequities with Māori men and for mainstream, there are two common denominators. One is men and men. We're all, particularly us older men, we're sometimes men of few words and men of few questions. The younger men coming through these days are not quite like that. They're more open, they're more questioning, they do things. And then on the other side, there's the inequity thing, and that's got a lot to do with location. That's got a lot to do with the difference between the medical language and in this case Māori men language, and so on. But it would be fair to say that gap is closing. It's closing, and it's good to see. I think I've covered about as much as I can. One thing that's always important is to try and keep the rest of your physical health going. And I guess one of the advantages that I had is I had no comorbidities, heart disease or diabetes and so on, so that's actually quite important. I also have a personal trainer His name is Samson, and he's a 2.5-year-old dog. And he's extremely important in my life because when you've got very little or no testosterone in your system, your ability to be able to get up and do press-ups and sit-ups is considerably reduced. And when you walk along the beach and you see a 3-foot surf where you would normally just go racing out there with your board and go surfing, you don't have that. You don't actually have that drive. So the dog's really important because he says, I want to go for a walk now, and away we go. And remember that your physical health also helps you fight this disease. Thank you for listening to me this afternoon, and it was a pleasure talking to you.